American football and the NFL have played a major role in our society as a major pastime, as a major community builder over the past decades. Not only is football big recreationally, but it's big in helping us build morals, values, and grow as a society. However, although we recognize the recreational benefits and values of the game, we often overlook the health risks that come from a high intensity, high impact sport. One of these major risks in the NFL today are concussions. Today, we want to talk about three basic things. What is the NFL? The basic foundation of the game and the league itself. 2. Concussions. What are concussions? Why are they serious? And what are the symptoms and treatments? 3. What is the NFL doing to prevent and to promote mental health in their game and protection against concussions? With that being said, let's start out with the basic history and foundation of the NFL. The NFL was actually founded in 1920, September 17th, 1920, in Canton, Ohio. And when it was first formed, it was actually called the American Professional Football Association, or the AFPA. In 1922, the league was renamed to the NFL, or the National Football League, what we know today. The league's first president was actually Jim Thorpe, who was at that time arguably one of the most influential, popular athletes of all time. The league is comprised of 32 teams into two different leagues: the AFC, or the American Football Conference, and the NFC, the National Football Conference. There are 4 games preseason, 16 regular season, and 4 playoff games, with the Super Bowl being the finale. So now that we have a basic understanding of the league of the NFL, let's talk a little about concussions. A concussion is a traumatic brain injury, or a TBI, that is caused from a hit, blow, or body jerking that can cause the brain to roll around in the skull and cause brain damage, cell damage, and also chemical imbalance and changes in the brain itself. Concussions can last anywhere from days, weeks, months, and symptoms last years and even lifetimes if not taken properly. Some of the symptoms of a concussion are things such as sensitivity to light, balance issues, memory loss, headaches, and many, many more. There's a plethora of symptoms that are evident when a concussion occurs. Usually concussions are not life-threatening. However, if there is severe bleeding in the brain or brain damage, surgery may be required. Although we talk about concussions as not being life-threatening, they are definitely life-altering, especially for athletes. A doctor will ask you usually to refrain from strenuous activities such as sports, as well as provide pain relief medication. On top of this, over the first 24 hours, you most likely will be awoken in the night every 2 hours to prevent your body from falling into a coma. As you can see, concussions are very serious and can have long-lasting effects. That being said, let's take a look at what the NFL is doing to prevent concussions. The first thing the NFL does is they invest heavily in equipment, mainly in helmets, seeing as that's where concussions happen, is in the head. We started out in the NFL in 1920 wearing light leather helmets. We moved to hard leather, then to hard plastic, and now we have things such as the 0-1 speed, which the NFL has invested millions in an attempt to reduce concussions. This helmet has 4 layers of padding designed to disperse the shock of hits. The second piece of equipment the NFL uses is called a neck roll, that is designed to reduce trauma on the neck and spinal area when vicious hits take place. The second major thing the NFL is doing is they're putting rules in place to discourage helmet-to-helmet hits, or hits above the shoulders, and hits to defenseless players. Since these are the hits where concussions most likely will be occurring. There are penalties such as penalties in the game, fines, being kicked out of the game, and suspended for future games. Third, and arguably the most important thing the NFL is doing, is called the Concussion Protocol Program. This program consists of 6 basic steps to help prevent and to help athletes recover from concussions. The first step is that if a player is suspected of having a concussion, he is immediately, no questions asked, pulled from the game. Second, a team physician will watch the tape of the play, evaluate, and perform a neurological exam of the player on the sideline. If If the suspicion of a concussion is there, a player will be immediately escorted to the locker room for a full, extensive evaluation. If a concussion, if the player is diagnosed with concussion, there is no same-day return to play policy. However, if the player is not found with a concussion, the player will be monitored throughout the rest of the game in the coming week, just in case, to see if there are any effects or any other damages that can be happen as the athlete is vulnerable. As you can see, concussions are very serious, and they plague the NFL today, a major pastime and recreation and character builder in our society today. The NFL, concussions, although are very serious, the NFL is taking great stands, and they are taking great stands, precautions in order to prevent this and to protect the longevity of the sport as well as the athlete's career and future lives. An understanding of this topic can help us be more aware of the proper measures and precautions that we can take to prevent this in our own lives, as well as be aware of the issues that can occur in the lives of athletes in order to help raise awareness and prevent it for future issues and others as well.